This week's lecture on health promotion is about the use of a settings approach in health promotion. So it's building on a progression of the history of health promotion from the 1970s. And if you cast your mind back to the definition of health promotion is a process, uh, and it's a process that focuses on enabling people and communities to increase control over and to improve their own health. And it reflects this definition of health, this comprehensive, holistic definition of health as a complete state of physical, mental, and social well-being, and not just the absence of disease. So that's the basic concept of health promotion. And within the umbrella, under the umbrella of health promotion, there are a range of different aspects. So preventive health services, community-based activity, organizational development, public policies, environmental health, health education, and economic and regulatory activities. All are these upstream factors which affect health promotion. In the 1970s, so what I was talking about just at the start of this session is that in the 1970s there was a real focus on looking at preventable diseases, and particularly the communicable diseases, so immunization against viral diseases such as polio and measles, etc. And also looking at risk behaviors, and the primary one being, but also some work through this very primitive sort of idea of if you give people information and educate them, that they will modify their behavior, and we know that has a very limited scope. If we move forward another 10 years in terms of the development of health promotion, there was a transition. We call this the second dimension of health promotion, where individuals were not so much health consumers, so they weren't so much just people who looked to services in health, but approach to health, that is this idea that health is the absence of disease, through to a much more ecological, holistic view of health, that health is all around you and health is a resource. And there's this really discrete but quite important move in terms of policy necessarily within the health sector. But what this movement was towards is to establish an idea that all policies, all government policies, should be healthful. And also there is this other added dimension, more of a focus on research. So that's what happened in the 1980s. That was a transition. And if you'll remember, we've got these 5 elements of health promotion that you there's these 3 actions. But going back to the 5 elements, strengthening community action, develop personal skills, creative supportive environments, and reorient health services. Very important to remember. And of course, the Ottawa Charter is the main vehicle by which these messages have been transmitted. It's basically held in high regard, and it's said to be the formal birthplace of the process of health promotion. And also other texts allude to it being a landmark in health promotion. The Ottawa Charter. So when we look at the Ottawa Charter specifically talks about healthy public policy, and it talks about it in a range of different contexts, so in schools, local government, workplace, hospitals. Also, it talks about how we might be able to use the taxation system, the budgeting system, to actually orient behavior towards healthier activities. It also starts talking about supportive environments. So supportive environments is one of the key elements. Now, these could be physical environments, they're social environments. They could involve actually assessing environments, so we know which direction particular trends are going, and also the protection of environments, whether they be built environments, cities, or natural environments, so that we can conserve natural resources. So these are all elements of the Ottawa Charter. The further elements of the Ottawa Charter are centered around community action and personal skills, and these are all examples of these particular elements. So target group involved in designing and implementing so that the community actually has some sort of ownership. And this whole process of community participation, which enables them to identify issues and also satisfy some of their particular expressed needs. On a personal level, the idea is there's this transition from building knowledge and skills and information for individuals, but also a commitment to lifelong learning, strategies for individuals and communities to cope with chronic illness, and this word settings, which is the topic of this week's lectures. These aspects are facilitated in various settings. So, and the last element of the Ottawa Charter is reorienting health services. So, installing a culture of prevention. In fact, it's not prevention rather than treatment, because treatment is one of the main functions of health services, but it's basically the combination of prevention as well as treatment. And therefore training of health professionals in this regard, but also teachers. Teachers have a very important part to play in health education. Intersectoral collaboration, focus on the actual person, and also addressing the issue of access to health services, which is quite an important element. You can have the best services, health services in the world, but if particular groups don't have access for one reason or another, then your health service is going to be inadequate. So, again, I've talked about the 5 action areas of health promotion, and they provide quite a useful framework to develop comprehensive health promotion solutions to any particular issues. Now, we spent one of our online tutorials talking about childhood obesity. This task, if you care to take the challenge, is to consider another very important issue, health issue, and that is the issue of tobacco smoking, to develop a comprehensive strategy, set of strategies to address smoking using the 5 elements of the Ottawa Charter for Health Promotion. Now, so we've got this little historical account of health promotion happening here, and we've talked about the transition from the 1970s to 1980s. What happened in the 1990s was that there was a further dimension of health promotion added, the third dimension of health promotion, and it was focusing on settings. So, because we realized that people and communities live in places. So the examples of settings might be schools, cities. We might have healthcare settings, so there might be, say, a hospital or community clinic. And also, people spend a lot of time during their adult life in the workplace. So these are all examples of settings.